Shukran. Assalamu alaikum. Excellent talk. I think it's been said that cannabis is the gateway to heavier drugs. Is there evidence for that?
Thank you for the question. So it has been considered traditionally as a gateway drug. Many people may just experiment with cannabis and that may be it. But if there's early exposure, if there's other vulnerabilities in that individual, then they may progress to using other substances. So it's not necessarily always a rule that every cannabis user is going to move on to other illicit substances, but it may potentially open the road for other illicit substance use.
Okay, we have a question at the back there.
Yeah, hello. Hi, I'm not a doctor, so I hope I'm allowed to ask a question.
No, it's okay. Go ahead.
I got a friend, he's involved in drug rehab, and his motto is, it is a gateway. And he's involved in rehab in a big way here in Durban. My question is that I tend to agree with you when you said the use of cannabis, like we should declare cigarettes haram, smoking of cannabis should be declared haram. But the challenge I find is that the CBD oil, people who have lupus, who have cancer, are tending to use it. But that CBD oil is not being administered by medical professionals. It's being administered by non-medical professionals. And that's the query I have. How do we approach it?
Yeah, good point.
So I think, unfortunately, doctors have a lot of competition. So we have the neighbor, we have the sister-in-law, the mother-in-law, the best friend, everyone who used something with the other giving advice, and our advice also on one side. So for us as medical practitioners, we can only give advice from a point of what evidence we know. We can't comment on something we don't know, unfortunately. So there's still a lot of don't know around cannabidiol, and for us, at the moment, we can't prescribe something that has no clinical evidence, ethically. So I think there's a need for more research to look at cannabidiol specifically and immunosuppression. The suggestion is that it definitely helps with immunosuppression. It may have a role to play in multiple sclerosis and in certain subtypes of cancer. I know of GPs who've prescribed cannabis oil rather than sending the patient to an oncologist for chemo. And we need to understand that the cannabis oil may help with the analgesic and the vomiting associated with chemo, but not going to treat the underlying cancer. So I think we firstly must get our act together and then be able to advise the public appropriately.
Can we have a question from the ladies? Any questions from the ladies, please? Hey? A lot of them use it, let me tell you.
We're seeing a lot of cannabis in women.
Ahmad.
If a patient has a life-threatening disease, can the patient refuse treatment? And what is the Sharia position on that?
The short answer to that question is that if it's all a equation of probabilities. So if the medical advice is that by not taking a medical treatment, that this would lead to the loss of life, then it is an obligation to seek that medical treatment. The opinions that were mentioned earlier in the presentation by our respected professor was regarding medicine that didn't cause loss of life, or the absence of taking that medicine didn't cause loss of life, i.e. there's no serious medical value in the consumption of such medicine. But anything or any treatment, the lack of which would result in the loss of life, then under the premises of hifzun nafs, of the nafs being protected, life being protected, it would be deemed a wajib. And that's where also the ruling of ad-daruratu tubihul mahdhurat comes in, that there is no halal or haram at that point when there is fear of potential loss of life.
Ahmad, do you want to ask a question? You sure? Oh, you asked. Yes, okay. There, sorry. There's a lady there.
My question is directed at the psychiatrist. In your experience, the people who do present with psychosis after cannabis use, is it after excessive use, or is it just once off? And do you see older people also presenting with psychosis, or only young people?
Hello. Yeah. So cannabis use is associated with psychosis. Obviously, it makes the psychosis come earlier. So if someone was using cannabis regularly and frequently, then they're more likely to present 2 or 3 years earlier than they would have normally presented, because often these are individuals who may have had a genetic or biological vulnerability to psychosis anyway, but it comes earlier. You may have sometimes a substance-induced psychotic disorder, which is only related to the cannabis, so not necessarily a schizophrenic type illness, but someone who may have had high-potency cannabis, not used to it for the first time. They may come in with psychotic features after that, and that's a short-lived temporary psychosis. But also those individuals, if they go and smoke again, they're more likely to get psychotic. Generally, if someone became psychotic and had cannabis use, if they stop the cannabis use, the good news is that the illness is not going to have long-term implications. But those who continue to use cannabis in the face of psychosis have poorer outcomes, because obviously they're more likely not to take their treatment. They're going to smoke and not take treatment. And so their psychosis is more recurrent, and the more times you have psychosis, it's also a little bit neurodegenerative. It becomes harder and harder to treat, and these individuals become more dysfunctional, unfortunately.
Okay, we'll take the last question because it's getting quite late. Yusuf?
Okay. Saeeda, my question is, slightly off your topic, but recently in the literature, we've been hearing talks about this whole theory of chemical imbalance in the brain being a hogwash theory, it's a big pharma push. Any sort of comment on that?
Yes, there's been a recent article that suggests that the whole serotonin theory in depression is skewed. And I agree. As I say, I think at the moment we know so little about the brain. We know that we work on what little we know. And probably what I know today is probably not even 100% correct. I'm the first to admit it. I suspect it will take us a long time to properly understand the intricacies of the brain and to understand how mental illness properly evolves. But I think what we can't move away from is that mental illness is something from the brain. I think if we start saying, oh, well, the chemical theories are hogwash, so mental illness doesn't exist and it's something we made up and just pull up your socks and carry on, etc., then we're also going to be doing our patients a disservice. Yes, definitely there's very little understanding of what exactly causes mental illness, but for now we use what evidence we have and try to help our patients to the best of our ability.
Okay, I think if there's no other questions, we must close. But before we close, you want to say something? Just a minute. Sorry?
Can I just ask quickly?
Okay.
What do you mean by psychosis, if I can ask? What does it entail? Sorry.
By psychosis, we mean the patient has impaired reality testing. So they would develop symptoms like hallucinations, delusions, disorganized behavior. They may also have negative symptoms. So they become withdrawn, isolated, not able to communicate with others, etc. But there must be positive symptoms as well. You can't diagnose psychosis on negative symptoms alone.